All right, I am happy to be joined with Dr. Mike Hart. He joins us. He's the host of Heart to Heart podcast. He's the founder of ReadyToGo Clinic, which emphasizes on cannabis medicine and ketamine therapy. Dr. Hart, how are you?
I'm great. Thank you so much for having me on, Shaw. Really appreciate it.
Yeah, a lot of big news, obviously, within the psychedelic industry. What are you seeing, I guess, from your profession as far as the topic of conversation as this industry continues to expand and progress?
Well, I guess the topic of conversation, over the last day or two, anyway, has been that new study that just came out
Yeah.
in the Journal of Medicine. So, everyone's been talking about psychedelics now for a few years. We do have some pretty good evidence that psychedelics are effective. We just didn't have a randomized control trial comparing psilocybin to a selective serotonin reuptake inhibitor, which is a classic antidepressant. So, citalopram, or also known as Cipralex.
Okay.
So, it's very, very interesting that this
Yeah.
study just came out. There's I know that you've reported on it. I've seen a lot of other media outlets report on this. So it's huge news, and I think that's probably the biggest buzz in the industry right now.
Well, the reason, I guess, why we wanted to have you on here today, but when you look at the blueprint of this research, I know in the medical field, a lot of people are still being conservative with the outcome. They don't want to say too much, but
Mhm.
where it stands right now, what do you think this whole research provides, or most importantly, what's the future look like for this particular? I don't want to say like the industry, but more specifically with psilocybin designated towards major depressive disorder.
Yes. So, I mean, I think that, the big thing that this study does is add some legitimacy to the healthcare providers and the physicians who are, advocating for psilocybin use for patients who struggle with mental health.
Right.
Um, and then, just I think it's also important, to talk about the specifics of the study and to kind of break it down a bit. So there was 59 people in this study. 30 people were in the psilocybin group. 29 people were in the placebo group.
Yeah.
Sorry, I shouldn't say the placebo group, in the Cipralex group. So what they did is they split those two groups up. Gave obviously the psilocybin group psilocybin and the citalopram groups citalopram, and then observed the differences. And what they found was that overall there was actually a little bit more of a better effect in the psilocybin group as opposed to the citalopram group. So the score, I believe, went from 0 to 27,
Okay.
and the improvements in the psilocybin group were about 8 points, whereas the improvements in the citalopram group were about 6 points. So definitely a little bit more.
That's big though, is it not? Like that's big.
It is pretty big. I was kind of surprised at some of the conclusions of the study, because it basically said that psilocybin is as effective as Cipralex or citalopram. But if you look at the study in detail, there is definitely a slight edge overall in the psilocybin group. And the other thing too is that the psilocybin group had less rates of remission of depression. And there was also another note in the study that said that about 70% of the people in the psilocybin group had significant increases in their depression scores, whereas it was only about 48% in the citalopram group. So again, it does show that
What about side effects? Because let's face it, side effects is a big topic of conversation when it comes to prescription drugs right now.
Yeah, so side effects of SSRIs unfortunately are pretty common. The biggest ones that you'll hear about are fatigue. Sometimes people get headache and some nausea. Another big one though is sexual dysfunction. So for guys, they develop often erectile dysfunction, and then for girls, they say that it's very difficult to reach orgasm. So obviously, you don't want to be prescribing things that are going to interfere with people's sexual function or make them tired. And
Yeah.
those things are just not observed when people are taking psilocybin. So really important point that you just made, because
Hmm.
you want to make sure that not only is a drug efficacious, is it does it work, but also is it safe, is it tolerable? And psilocybin absolutely appears to be very, very tolerable and very safe.
What are you hearing privately and through conversations with your peers in the industry, with the feedback that came and the potential of psilocybin to treat, like I said, the major depressive disorder?
Well, the major feedback that I find is that for the most part is that physicians are just eager to get after this. They're really
They
eager
are. Wow.
to prescribe it. I think that, there's always going to be some physicians who say that, we need more studies and that type of thing. And I'm not saying that we don't. I think that, we do need more studies comparing psilocybin to other drugs like Cipralex. But, unfortunately right now, we don't have those studies, but I don't think that we need to wait any longer to prescribe. So I think that it's okay to prescribe based on the evidence that we have now, but that doesn't mean that we should stop researching psilocybin. So, I think that we can do both. We can prescribe because we have enough evidence to do that, but we also need more evidence that we know how to administer this so that it gets the most efficacy out of psilocybin.
Makes sense. Wanted to ask you this week, GH Research Ireland raised $125 million in a Series B round to advance DMT analog through clinical trials. Are you hearing anything about the therapeutic potential of DMT, and which psychedelic compound do you feel has the best chance of becoming medicine for depression?
Very good question. I mean, just based upon the legality and the fact that, there's quite a bit of research on psilocybin, I would say that that's probably going to be the first one. And, I know that there's specific states and cities that are looking at legalizing psilocybin or
Yeah, it
already
seems to be.
DMT is definitely talked about a lot in the research field, and it's definitely talked about amongst healthcare practitioners, but there's probably a lot less research on DMT versus psilocybin right now at this point. So because of that, I think the psilocybin will be first. But DMT, appears to be a very, very potent and wonderful molecule for alleviating depression, alleviating anxiety. And people also report these kind of like mystical experiences, so to speak. In that terms, mystical experiences has been described in John Hopkins studies on psilocybin before as well. And it's important to note too that with DMT, a lot of people don't realize that like people take this and then they don't do it again maybe for 6 months. Sometimes people don't do it ever again in their life. Sometimes people do it once a year, and it's a very, very short duration of the drug. So meaning that it only lasts about 5 maybe 10 minutes. So you inhale your DMT and then right away, like, you're just kind of gone. You
Wow.
have a very, very acute psychedelic experience, but then you're back within about 5 to 10 minutes. But within that period with DMT, the primary thing that we believe that the DMT does that helps people with mental health is it really breaks down their ego and causes a ton of ego dissolution.
Interesting.
So because
In
of that,
5 to 10 minutes.
Yeah, 5 to 10 minutes. Very, very quick acting medicine, but also a very, very potent medicine. So it works very, very differently. Now, if you're looking at psilocybin, just to kind of circle back on that, psilocybin can be obviously given in different doses, right? And the doses that people talk about often are micro doses and macro doses. And what are those? So, microdosing is generally just taking a very small amount of the medicine so that it doesn't have an actual psychoactive effect overall. You can't necessarily really, you're not going to, I shouldn't say that you're not going to feel it, because you are going to feel it. You're going to feel more empathy. You're going to feel more warmth, more love, so to speak, and alleviation, depression, and anxiety. But generally at these microdoses, you're not going to like hallucinate or be paranoid or have any of these type of effects that some people get when they do, quote unquote, trip out. But coming back to, a macrodose on psilocybin. So, Terence McKenna is kind of like the godfather of this. And he's always said that 5 grams or more is considered to be a heroic dose. And then, so at 5 grams or more, that's when you can have, a DMT-like experience. I mean, again, they're very different. You talk to people who, who've taken those 2 medicines, they'll describe them as very different, but you're definitely going to have a very, very acute experience like you would have with, say, DMT. And then I kind of just skipped over the microdosing protocol part. So, there's basically 2 protocols that I know about. One of them comes from Paul Stamets. One of them comes from James Fadiman. So the Paul Stamets one is he usually recommends 100 micrograms 4 to 5 days a week with 2 to 3 days off. And then the James Fadiman protocol is more about zero 0.3 to zero 0.5 grams twice per week, or sorry, every three days. But a lot of people just do it twice per week just for simplicity's sake. So those are sort of the two kind of methods.
Well, it's really interesting. Like when I listen to you and, the amount of like information that you're already aware of from a medical standpoint and how this continues to progress, it's encouraging to see because as we know, there's when the lot of people I speak to, it's just like they want alternative solutions and anything but pills. And I know with your expertise in the clinic that you run Ready to Go in London, and your approach on all this has garnered a lot of attention, including appearances on the #1 podcast in the world with the Joe Rogan Experiment. Right now, do you offer any sort of like anesthetic related psychedelic medicine? And if not, do you plan obtaining a license to do so in the future?
Yeah, so really good question. And, I've been prescribing ketamine since 2019. I've actually been published for it. So, I've had patients on that now for about 2 years, getting excellent results, treating them mostly with pain, depression, anxiety. And like I said, the patients really feel that they benefit from it. One important distinction is, ketamine often does get grouped into, the classic psychedelics. The classic psychedelics I refer to are psilocybin, LSD, and MDMA. Obviously, DMT is a psychedelic as well. So is ayahuasca. And for people who are wondering too, the active ingredient in ayahuasca is DMT, but it's just a much longer trip. It's over 4 to 6 hours. But ketamine therapy, is something I've been doing for a couple of years, and basically, even though ketamine, as I said, is an anesthetic, it's not a psychedelic. It does give people this sort of like psychedelic-like experience where they kind of feel dissociated. Dissociate is probably the best feeling I can describe. Some people do kind of feel like when you take ketamine, it's you almost get like a little bit of like a drunk feeling as well. So different people do have different experiences.
Yeah, I heard that.
But for the most part, a lot of the research on ketamine is giving it IV or IM. In my practice as a family physician, what I do is I prescribe it orally. So I have patients take 75 milligrams. I have them take it on their own, and sometimes I have them take it with a therapist. So I offer both treatments, so as a monotherapy or as a complementation or as a complement to psychotherapy. So generally speaking, when people take this medication for the first 30 minutes or so, I'm talking about taking it orally, they don't experience anything in the first 30 minutes. That's how long it takes to kick in. Then for about 30 to 45 minutes, they have what I would like to call like a light psychedelic or dissociative like experience.
Interesting.
And then 30 to 45 minutes after that, it tends to wear off, and within about 2 hours, you're basically back to baseline. That's usually how most people find it. Generally,
Are you getting more people inquiring more and more about this?
Yeah, for sure. I mean, the thing is, like, it's because I feel like we've been hit twofold with this because, prior to, COVID, there was already sort of like a mental health
For
crisis.
sure.
And then, now that COVID hit, things are much worse. People, just don't have access to the services that make them happy, so to speak. A lot of people, they go to the gym, they go to, different types of sports facilities, recreation to kind of blow off steam type of thing. And they just aren't able to do that now. And then obviously too, the financial burden has been crushing to a lot of people. So that's making people depressed. So, we have that going on. And then, getting back to the SSRI, so, like that medication, Cipralex is an SSRI. So SSRIs, I believe, came on the market in 1984, I think, around that era. So, it's been almost, 40 years that we've just been prescribing SSRIs as a mainstay for mental health. So, I think that we do need a new class of medications. And I think that, using medications like psilocybin, which is a psychedelic, is an excellent resource for patients. Again, unfortunately, like that's not something that we can prescribe right now. So that's why I'm prescribing ketamine, and why I've had so much success with it is because I feel that it's a different class of medications that a lot of my patients haven't used before, and they're getting a much better response. So instead of switching out their antidepressant for another antidepressant that has a similar mechanism of action, they're substituting it for ketamine, which is something completely different, has a completely different mechanism of action, So they're getting a very different response, and overall they're getting a very positive response.
What's their quality of life like in
Quality
some
of life
cases?
is increasing significantly. And actually,
Really?
that's one of the measures that we measured when I did a study on ketamine. So I have been published for ketamine before. It was just a case study with about 3 different patients, but we did evaluate the quality of life, and it did seem to increase quite significantly.
This has been great. Let's keep in touch. I'm going to have you on every single week, but this has been very educational. Great report out this week and a lot of progress in the right direction. We're glad we're going to be able to connect with you with a lot of great resourceful information, but I appreciate you taking the time, Dr. Hart. Let's keep in touch.
Well, thank you so much for the interview, Shad, and looking forward to the next one.
Yeah, take care.